As a society, we're becoming increasingly, if we're not there already, reliant on our phones. Not only do we use them to stay in touch with contacts and news, but we can also shop fashion, gifts and food. The COVID-19 pandemic saw major innovations in shopping apps, with groceries and healthcare essentials now being delivered within 60 minutes. Another innovation was the introduction of video and telephonic doctor consultations. Now, these allow patients to receive medical, health and wellness advice. For more on this, we're joined by Damian McHugh, Executive Head of Marketing at Momentum Solutions. Thank you very much for your time this afternoon. And so when we talk about virtual consultations, especially where healthcare is concerned, are we seeing an uptick? Is the new normal gaining momentum?
Absolutely, and hello, Didi, and thanks for having me, and hello to your viewers. Absolutely, we see lots of usage of digital solutions in our healthcare space in South Africa. I think, as you rightly say, COVID has changed quite a lot of things for us, and the delivery of healthcare is one of those things. Look, it will never replace visiting a doctor face-to-face. Can you imagine me trying to hold my tonsils up next to this camera for the doctor to see? Some things just don't work that way. But there are opportunities for us to use digitized technology to improve access and quality of healthcare in South Africa, particularly, in our, the areas that your previous report was at. Sometimes it's difficult to get access to clinics and services in countries like South Africa. The access is not always good. We don't always have our own transport. And so being able to deliver that through technology really does improve the quality of accessible healthcare to many of our South Africans.
Yeah, Damian, you do mention a place like Dundee and KwaZulu-Natal, and I think maybe I go to a point of access to data, for instance, or access to Wi-Fi. How much does this complicate the proliferation of online consultations in a place like South Africa, where many people are cut off to that kind of access?
Look, it does. I think all of our technology-enabled devices do require data or, Wi-Fi accessibility. So in really, really poor communities, even the advancements that we're making, some of the digital capabilities that we're providing, don't always provide that. But what we've done here is a lot of this is actually done telephonically. So you can send a USSD sort of number, so it's a free service, and then the doctor calls you back on your number. So it's not always related to data, the way in which our services are enabled. And it allows the member not have to use their own limited data. It allows the client for the doctor to call them back, and then they can get the treatment done, telephonically that way. And then, as the delivery capabilities also improve, our capabilities then enable the patient to get medicine delivered to them as well. Now, that's not possible in every location. I absolutely get it, but it's a hang of a lot better than, having people not having access and having to wait until clinics or pharmacies or doctors open at late hours. Often after hours, doctors are only open during business hours. And so here you even get, telephonic advice services, after hours, which is often very, very critical. Our kids don't always get sick during these perfect working hours. Sometimes they're sick outside of those hours.
Yeah. And you also mentioned that digital platforms can facilitate the onboarding of clients and enable self-servicing around chronic condition management.
Yeah, absolutely. So what we see now, in more advanced technology is also the wearable devices. So we can actually start to help patients almost know before they're sick that they're going to be sick. You're not sleeping enough. You're not exercising enough. So our ability to start to influence the onset of chronic illnesses is unbelievably powerful if we use it correctly, and we can nudge people to do the right thing. Obviously, it's not a forced behavior. We want people to do the right thing out of their own fruition, but also the management of chronic illnesses, the management of taking drugs, making sure the drugs are available when people need them. Again, certain drugs are only effective if you take them regularly at the right timing intervals. And if you don't have access to those drugs at those times, you jeopardize your management of those conditions. So again, the digital onset and the delivery onset of those technologies really, really help. And even more than that, I think what we've also seen is this platform also helps us with public-private partnerships. And we've got two sort of case studies going, one at the Delft Clinic in the Western Cape and also in Soshanguve, where we're using the telephonic services to actually help alleviate some of the burden on the state. And as a result of that, we have this service available so that people don't have to queue. They can call a doctor, the doctor calls them back. And about 40% of the calls that we do don't result in a member having to stay in the queue. So it actually alleviates the queue burden, if you like, for people who really do need the service, and it takes some people out. some people we just refer straight to, over-the-counter medication. So again, it alleviates a lot of the burden that we see within the public facility. So I think that, the digital era is on us, and we must make sure we embrace it in the healthcare sector as well.
Yeah, that alleviation of queues, that's such a welcome move. I do wonder, though, Damian, like you mentioned in the beginning, I don't want to imagine seeing tonsils as, I'm not even a doctor, but when you're consulting, I do wonder what the resistance was, if there was any, right? Because some people prefer to actually see or use the traditional way, or what we think is traditional, of seeing a doctor. Was there resistance when you piloted the project from everyday South Africans?
Yes and no. I think you always get early adopters in technology, and you get some people who don't. And I think it's where we apply the technology in its most useful manner, where you see it, like in some of these public sector clinic areas where there's a lot of burden. People actually adopt it quite quickly because they're able to get access and you speed up the services. I think even for me, there will be times when I will use digital technology. There will be times when I use digital technology to shop. But there's other times where I actually want to touch or feel the product or see the product. And similarly, I think, with our provider network. So you'll have early adopters who will use it for everything, although there's some things which just limit it. I mean, it's very difficult for me to take my temperature with a doctor. I must have some technology maybe myself and say, look, doc, here's my temperature, and I take it myself. But I think that those types of things will adapt as we go on, and particularly with the wearable devices. Again, that's for a different segment, sure. But the wearable devices will also start to enable some of that digital adoption. So I think it's stages. There will some people that will always be a little bit hesitant, and there'll be some people that will move very, very quickly, and also the areas in which they're at. If we can make the service accessible, and improve the quality of care and the accessibility of the care, I think it will also adopt quickly.
And how are the doctors finding it? Any misdiagnoses?
No, not really. I think the doctors also have to know what their limitations are utilizing the technology. So in the beginning, pre-COVID, a lot of the doctors were quite nervous of digital adoption and digital technology. They almost saw it as a threat, and I don't mean that in a bad way. I think the advent of COVID, gave us better legislation to enable this sort of technology to happen, but also doctors realized that it was safer for them, during that time. They could see patients without necessarily exposing themselves to what at that stage we didn't know how that pandemic would evolve. So I think doctors have embraced it. Again, there will be doctors who will say, no, don't use this type of technology but again, I guess is dependent on the doctor and the nature of the services that they provide as a doctor. The more specialized categories, there will be difficult things to do, utilizing the sort of technology that we're using. But I think that, there are definite spaces for it to operate, and we need legislation to move for us to be able to accelerate that as well.
What does that mean in terms of legislation to enable you to move? Where's the blockage?
Maybe the simplest way of saying it, our Medical Schemes Act was written in 1998. That's 25 years ago. The very people that are utilizing healthcare solutions in South Africa today, the Act didn't even know who they were. They were born after the Act was actually written. So I think the Act can be updated. I'm not saying the Act's wrong or it's bad legislation. I'm not saying that at all. I just think it needs to be refreshed for this type of technology, and enabling this type of technology to grow in a responsible way. It mustn't be irresponsible, obviously, but in a responsible way. I do think the legislation can make it easier for providers to utilize this type of technology in their practices.
Damian McHugh is the Executive Head at Momentum Health Solutions. Thank you, Damian.